Hi everybody, this video of mine is about earwax blockage. This occurs when earwax, that is also known as cerumen, accumulates in your ear or becomes too hard to wash away naturally. Earwax is a helpful and natural part of your body's defenses. It cleans, lubricates and protects your ear canal by trapping dirt and slowing the growth of bacteria. If earwax blockage becomes a problem, you or your doctor can take simple steps to remove the wax safely. Now I'll tell you the symptoms of earwax blockage. Signs and symptoms of earwax blockage may include earache, that is pain in the ear, feeling of fullness in the affected ear, ringing or noises in the ear, that is known as tinnitus in our medical terminology, decreased hearing in the affected ear. You may also suffer from dizziness and cough. If you are experiencing the signs and symptoms of earwax blockage, you should talk to your doctor. You may think that you can deal with earwax on your own, but there is no way to know if you have excessive earwax without having someone. Usually your doctor looks in your ears. Having signs and symptoms such as earache or decreased hearing does not necessarily mean you have wax built up. It is possible you have another medical condition involving your ears that may need attention. Wax removal is most safely done by a doctor. Your ear canal and eardrum are delicate and can be damaged easily by excessive earwax. Do not try to remove earwax yourself with any device placed into your ear canal, especially if you have had ear surgery, have a hole, that is perforation in your eardrum, or are having ear pain or drainage. Children usually have their ears checked as part of any medical examination. If necessary, a doctor can remove excess earwax from your child's ear during an office visit. Now I'll tell you the causes. The wax in your ears is secreted by glands in the skin that lines the outer half of your ear canals. The wax and tiny hairs in these passages trap dust and other foreign particles that could damage deeper structures, such as your eardrum. In most people, a small amount of earwax regularly makes its way to the opening of the ear, where it is washed away or falls out as new wax is secreted to replace it. If you secrete an excessive amount of wax, or if earwax is not cleared effectively, it may build up and block your ear canal. Earwax blockage commonly occurs when people try to clean their ears on their own by placing cotton swabs or other items in their ears. This often just pushes wax deeper into the ear rather than removing it. When I was a medical student, my teacher used to tell me, do not fiddle with your ear on your own. Okay, that I still remember, and this is what I wanted to convey this message. Okay, now coming to the diagnosis of earwax, it's very simple usually. Your doctor can determine whether you have earwax blockage by looking in your ear with a special instrument that lights and magnifies your inner ear. This is known as otoscope, and this is very simple to diagnose. Okay, coming to the treatment. Your doctor can remove excess wax using a small curved instrument called a curette, or by using suction while inspecting the ear. Your doctor can also flush out the wax using a water pick or a rubber bulb syringe filled with warm water. It's very easy to treat people who are suffering from earwax blockage. I have been treating so many people successfully. If earwax built up is a recurring problem, your doctor may recommend that you use a wax removal medication such as carbamide peroxide, that is known as Debrox earwax removal kit, Murine earwax removal system. Because these drops can irritate the delicate skin of the eardrum and ear canal, use them only as directed. And I'll tell you some alternative medicines. Some people use ear candling, a technique that involves placing a lighted hollow cone-shaped candle into the ear to try to remove earwax. The theory is that the heat from the flame will create a vacuum seal and the earwax will adhere to the candle. However, ear candling is not a recommended treatment for earwax blockage. Research has found that ear candling does not work and it may result in injury such as burns, ear canal obstruction, and even perforations. So I do not recommend ear candling at all. Okay, you should talk to your doctor before trying any alternative remedies for removing earwax. Now I'll tell you some lifestyle and home remedies. If your eardrum does not contain a tube or have a hole in it, these self-care measures may help you remove excessive earwax that is blocking your ear canal. Softening of the earwax. Use an eyedropper to apply a few drops of baby oil, mineral oil, glycerin or hydrogen peroxide in your ear canal. Use warm water. After a day or two, when the wax is softened, use a rubber bulb syringe to gently squirt warm water into your ear canal. Tilt your head and pull your outer ear up and back to straighten your ear canal. When finished irrigating, tip your head to the side to let the water drain out. You should dry your ear canal. When finished, gently dry your outer ear with a towel or handheld dryer. You may need to repeat the wax softening and irrigation procedure a few times before the excess earwax falls out. However, the softening agents may only loosen the outer layer of the wax and cause it to lodge deeper in the ear canal or against the eardrum. If your symptoms do not improve after a few treatments, see your doctor. So it is always better to check your doctor rather than trying your own procedures. Okay. Earwax removal kits available in store also can be effective at removing wax buildup. Ask your doctor for advice on how to properly select and use alternative earwax removal methods. Do not try to dig it out. Never attempt to dig out excessive or hardened earwax with available items such as a paper clip, a cotton swab or a hairpin. You may push the wax further into your ear and cause serious damage to the lining of your ear canal or eardrum. I hope you like this video of mine. If you have earwax or if you have any other illness, you please write down about your illness in the comment section of this video, and I'll try to reply your comments as soon as possible. And if possible, if I get time, I'll try to make a video on your illness. Okay. Until now, if you have not subscribed my channel, please subscribe it and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit, even if it is little bit benefit, please like this video and share this video with your family and friends. And if possible, share this video on social media such as Facebook, Twitter or other social media platforms. Thank you very much for watching this video. See you in next video. Bye.